everyone, welcome back to another video of channel, and I hope you guys are doing very good. I hope you guys are accelerating in your life. I hope you guys are doing very cool stuffs in your life, and I hope you are making very good decisions in your life, because that's important. So let's get started. What is a clinical experience? Whatever I'll be saying in this video, guys, I've collected this information from AAMC's website. I'll be linking it somewhere here, or I'll be putting it in the description. I got this information from Google. I got this information from all other resources, all other websites or medical school related to medical schools. I got this information from those websites. So let's get started. What is the definition of clinical? Here is the definition of clinical. I'll put it somewhere here. The definition of clinical is relating to the observation and treatment of actual patients rather than theoretical or lab studies. Okay, so what counts towards your clinical experience? Anywhere you are interacting with a patient, regardless of the location. I'll be repeating. Anywhere you are interacting with a patient, regardless of your location. It doesn't matter that you are at a home or you are in a clinic, you are at an urgent care, you are at an ER, or you are at a hospital. It doesn't matter. The thing is, you are interacting with the patient. That is what matters the most. And that is the clinical experience. Now, let's say you are a pharma tech. Let's suppose you are a pharma tech. Now, I'm going to give examples so that you guys can really relate that what counts towards the, what does basically interaction means. Let's say you are a pharma tech. So do you think that a pharma tech's job is directly related to a patient? I don't think so. That is related to admin work, or that is related to customer care or customer service. Now, does medical schools don't like customer service experiences? That's not a thing. I mean, that's an experience that's basically in customer service, you get a chance to talk to people, to interact with people, and that is really a good thing. And that is really a good thing in a medicine field as well, because you have to interact with patients. But that is somewhere, like you can list it somewhere in your experiences, but that is not a patient care experience. You're not being directly involved with the patient. So pharma tech is not a clinical experience. Many people confuse it with a clinical experience, but pharma tech is not a clinical experience. Is EMT a clinical experience? Yeah, why not? EMT is a clinical experience. Is scribing a clinical experience? Yeah, it is. It is even a shadowing experience. Well, now, what is scribing basically? Scribing is you're shadowing a physician and you're being paid. So it in terms is like something like you're being paid. It's like a job. So, but our main thing is that our main topic is related to clinical experience. Now, another example which I'll put in front of you is that, let's say you have a grandma, let's say you have a grandmother, you have a grandfather, or you have an aunt who is sick, or anyone. I'm so sorry. Or let's say you have anyone who's sick. So now, if you're taking care of that person, it also counts as a clinical experience. But that is, you're taking care of a family member. When you are taking care of family member, the rules, regulations, and everything like that formalism is not there. Like, it's a difference between taking care of someone in your family and taking care of someone outside your family. So the medical schools, now how will medical schools look at it? This will be your medical experience. Like this will be involved in your clinical experience, that yes, you are taking care of a patient. But what thing a medical school wants to see is that a medical school wants to see that what you are doing outside your family, and what are you doing to the people in your community. I have always emphasized on community service in my channel. If you haven't watched my other videos, guys, what are you waiting for? Please go and watch those videos. They have like some incredible stuff in them. Go ahead and watch those videos. I'll be putting the videos in description as well. I have made some like very good videos. I think this will be my 72nd video. I think so. I don't remember. But like, I don't count them. So I made a lot of videos. So go ahead and watch those videos, and hopefully you'll find a lot of information in those videos. I have named my channel as Dr. Emmanuel Javed. I'll be putting it somewhere here or somewhere here, like anywhere. So I have named my channel as Dr. Emmanuel Javed. Now, am I a doctor? No, I'm not. As of 22nd February 2022, it's 8 p.m. here and I'm recording this video at 8 p.m. So till date, I'm not a doctor. Okay, but why I have named my channel as Dr. Emmanuel Javed? It's because I have a strong belief and faith that one day I will be a doctor. So how long you should do it? Many people have been asking that for how long you should do it. Like, it's a tough question. How long you should do a clinical experience? There is not a specific number which medical schools are looking for, but somewhere around 100 hours is amazing. 200 hours is more than amazing. So there is not a particular number for that thing, but the more you do, the more you do, it is better. The more you do, it is better, right? So let's say that now the thing is that do you need to do this thing every day? Do you need to give like 4 hours every day? Or does the timing of your clinical experience matters? Yes, it does matter. But how you can do it is that do it like for 2 hours in a week, or do it like 4 hours in a week. That's it. That is more than enough. Go give your 2 hours, go give your 3 hours. I know it. I can understand. Pre-med courses are not easy. I can understand. It's a lot with organic chemistry. It's a lot with physics. It's a lot with biology classes, and it's a lot with MCAT, which is totally a different thing. And I get it. I totally get it. So how you can just put your toes in the water. That is how I say it. Just put your this is your finger. Just put your finger in the water. Just keep your finger in the water, right? Just give like 2 hours or 3 hours or 4 hours or 5 hours, as much hours you can give, like easily. If you can give those hours easily, right? You have to not burden yourself. You don't have to stress yourself about that. Just give 4 hours a week. So 4 hours a week. And if you're doing it, let's say in a month, you'll be making it 16 hours. And in 2 months, you'll be giving 32 hours. In 3 months, you'll be giving, oh, it's a lot of math. So 48 hours. And then it goes at 16, at 16, at 16. So what you need, so you're just giving 4 hours a week and see how that is increasing. In this way, you can gather 100 hours in 4 months, 200 hours in how many, like 8 months, right? And in 16 months, you can have 400 hours. So you're seeing like how that thing is increasing really fast. So you can understand why I am saying that just put your finger, the tip of your finger in water, just keep it there. Just find a day on which you think that you can take out time and give it to a hospital, or to give it to a medical center, or give it anywhere you can give that time and do stuff and get some clinical experience. And there you'll meet physicians, go and ask those physicians, shadow those physicians. There are some kind of virtual shadowing opportunities as well, because definitely due to COVID, the things have changed drastically. So there are opportunities out there. You just have to go and grab those opportunities. So I think this was it for today. I think you guys, I hope you guys understood that what is a clinical experience. And a last thing, which is what is the best time to start a clinical experience? The best time to start for a clinical experience is when you think you want to be a doctor. That's it. Like, let's say if you have a dream of becoming a doctor, then you have to go somewhere to get those experience and see how you feel when you are in a hospital, and how you feel when you are taking care of a patient, or when you are interacting with a patient, because that feeling matters a lot, because you have to see your patient's whole life. Your job will be to interact with patients. Your job will be to talk to the patients. Your job will be to deal with patients. So that will be your job. So you have to go and get those experiences and see how you feel. And if those things work for you, then you're ready to apply for a med school. And then, ready to apply for med school, there are like many other different things which also counts towards your application. But yes, clinical experience is really an important thing and critical. And oh my god, why I'm saying critical is because I've been doing CARS, critical analysis and reasoning skills. So that's why I'm saying critical, but the clinical experience is really very important. I'll be making a video on MCAT as well. I'm just trying to figure out things for myself for the MCAT, because I have to take MCAT. I don't know when I'll be taking it, but I'm just going through the content and stuff. So for this video, I'm signing off now. I hope this video was helpful, and I hope you guys got some kind of insight about medical or clinical experience. So if I was anywhere in the video, if I was not clear, do leave it in comments. I will read your comments and I'll appreciate your comments. And if you have any question or something, DM me in my Instagram. I'm available on my Instagram. I'm available on my Messenger. Anywhere you feel comfortable, I'm there to help you. And let me know if you have any feedbacks. Till the next time, see ya, bye, signing off, take care, bye.